Any amount of exercise beyond that is, they call it junk. It's the gym bro science way of saying, well, that you're just wasting time. You don't need to do all those extra sets. You're just not getting anywhere.
All right.
Again, this is not scientific. There's no one can say what they actually. What do you mean? Is it actually setting you backwards? Are you just wasting time? Are you going to get injured? Or is it just a matter of efficiency and just logically, why would you spend more time in the gym if you don't have to?
Bringing you a reasoned approach to health and fitness. This is the Phi Life Podcast.
Welcome to the Phi Life Podcast. I'm John Barber, and with me is Brad Pilon. And today we're going to talk about junk volume. This is not a scientific term, obviously. A few people have asked us about it, and it's the idea that, I guess, so specifically for weight training, resistance training, strength training, whatever you want to call it.
Okay.
And it's the idea that there's an amount of exercise worth doing. So weight training, strength training, worth doing, that's going to get you your result. I'm being very specific with the way I'm saying this. That gets you your goal, whatever your goal is. If it's a strength goal, if it's a muscle mass gaining goal. I think most cases we're talking about either strength or muscle mass, or whatever your performance goal is. And then any amount of exercise beyond that is, they call it junk. It's the gym bro science way of saying, well, that you're just wasting time. You don't need to do all those extra sets. You're just not getting anywhere.
All right.
Again, this is not scientific. There's no one can say what they actually. What do you mean? Is it actually setting you backwards? Are you just wasting time? Are you going to get injured? Or is it just a matter of efficiency and just logically, why would you spend more time in the gym if you don't have to? So I guess that's where we're going to go with it. And so there's different schools of thought. Actually, very instructively, I've got Mike Mentzer right here. He was the guy who pioneered the concept of doing as little as possible to get your result, and don't spend another minute in the gym if you don't have to. Then over here is Schwarzenegger, who did the most volume, like 35 sets.
Oh,
he just spent like hours and hours and hours in the gym. Now, both of them look amazing. I think Mentzer got ripped off by him in one of the Olympias. I think Mentzer looked better. He actually had a perfect score.
Nice.
But if you see pictures of them, I mean, besides these ones here, if you see pictures of them in their prime, they both look amazing.
Monstrous.
They both look maximum muscle. They can't really build any more muscle on their frames, or at least not. There's no more is needed, because they arrived at like a perfect bodybuilding shape.
Right.
Obviously, everyone knows who Schwarzenegger is, even if you're not into bodybuilding. Not everyone knows who Mentzer is, but if you just look him up, you'll see he just looks amazing, as good as Schwarzenegger. So here's a perfect example of how could you argue that Schwarzenegger, anything he did was wrong, because he looked great and he beat Mentzer, and he's regarded even by modern bodybuilders. He was the best. Even Ronnie Coleman's like, if he competed now, he'd beat us all. So, but then Mentzer looked just as good, I would say. He just wasn't as tall and didn't take up as much space.
It wasn't as charismatic either, though. Right?
Well, yes, Schwarzenegger had the personality. Those two didn't like each other. Anyways, the point is that, but then Mentzer also, I don't know, I guess you can't see Dorian Yates down there. He trained Dorian Yates, who ended up winning a bunch of Olympias, who followed the same minimalist concept of just do just enough to grow and get out of there. Yeah. Now, the caveat there is all of them were on anabolics. Yeah. So you could argue that both concepts both work, because the anabolics allow you to recover. So the amount of volume Schwarzenegger puts himself through might only work if you have enough anabolic agents in you to survive those type of workouts and continue to grow and not break down. And then on the other side, you could say if you have enough anabolics in you, as little as what Mentzer does will work, because, well, you're just going to grow anyways, because any stimulus will work. So it's impossible to know the answer here.
Right.
And I would challenge anyone to prove, based on your goal, let's just say it's strength. How do you know what set or rep is the one that's too much? Like, how do you know, I've crossed the barrier? 5 sets of 10 reps was enough, but the 6th set was too much. How do you know that? Like, you can't ever know that. And how do you run that experiment? Do you start at 1 set and do that, for 5 years? and then do 5 more years at 5 sets. The problem is strength and muscle takes for like a long time to accumulate. And you could never run this experiment on yourself realistically.
Right.
Because
we do have trials, but the trials are interesting, right? Because they show where this idea came from, right? When they're like, you get 80% of your results from the first set, and then you get 90%, it's just these diminishing returns. But those would be, I'm guessing, I don't have them in front of me, but 8, 12, maybe 16-week long trials. So what happens next, right? And then are they, even if they're naive, so people who don't normally work out, and then you change it up and then you do the exact same experiment with experienced lifters, people who've been lifting for a while, how do you know what happens after 12 weeks? It's a weird idea. And then you have, for every Dorian Yates and Mike Mentzer at completely like nothing, as little volume as possible. Then you have Lee Haney in the middle. And then you have Schwarzenegger and Serge Nubret on the far. I mean, you have examples of peak muscularity at minimalistic training, moderation training, and maximal training, volume-wise.
Volume, yeah.
So I don't know where you go with that. I think the interesting thing is people will always gravitate towards whichever one they like philosophically like the best, right? You're gonna have people who are like, oh, if I can just get it all done in 3 sets and get out of there, I'm doing that. And you have people who are like, oh wait, so if I can stay in and do 20 sets, there might be 0.002% more muscle gain than people who didn't do 20 sets. I'm into that, right? Yeah. And then everyone else in the middle is normally just hedging their bets either way.
Yeah, and I think some of it is, it's not really like Mentzer and the minimalist stuff, like Dorian Yates and Mentzer. Dorian Yates would bench press 500 pounds for sets for his maximum, what he would call his working set. But he worked his way up to 2, 3, 4, 5. So he's pyramiding up, and he's not considering those working sets. He calls those warm-ups. None of these other guys lift that heavy. So they're like, Haney would never go that heavy, or Serge Nubret, the guys who do the higher volume. They're never getting to 500. They're not even going to 400. They're somewhere, again, these are massive numbers for the average person, but for these guys as a comparison, and we're specifically using these guys because they're likely all on the same amount of anabolics, and they all arrive, like we said, at roughly the same shape. They all look amazing, heavily muscled, ripped. So if all of them end up in the same look, well, some of them go maximum with 1 set heavy, but they have to pyramid up to that. You can't just go 1 warm-up set straight to 500 pounds. You tear every muscle.
Right.
Whereas these other guys who do all the volume, they don't quite go that heavy. So they're staying somewhere below that number. One of the arguments is all of the guys who went really heavy all got injured. And Yates has torn almost every muscle in his body. Ronnie Coleman can't even get out of a wheelchair anymore.
Oh, he's bad.
And those guys went super heavy. And one of Haney's concepts, and maybe Serge Nubret too, was never go that heavy. And now in their, however old they are now, they're not all busted up. Haney had no major surgeries. He hasn't torn any muscles, like nothing like these other guys have. So one of the arguments is, if you're going to max it out heavy, and that's the way to do minimal volume but get maximum results, you're potentially introducing a huge risk of injury by the necessity of the weight having to be so high if the volume's so low.
Right. And that's why we have people arguing that it's the challenge, right? The amount of either they do the reps above a certain threshold of effort, or they do the reps close to failure. They try to measure it or quantify it some way differently, right? But it seems to really just be some sort of algorithm based on, okay, if you're going to do very, very high effort, then the volume has to be low. If you're going to do very, very high volume, then the effort has to be low, but you're still, imagine they're still training to failure or close to failure on each set, right?
But also, if you add up total pounds of weight lifted or moved, if you consider all the warm-ups it takes to get to that maximum set, their volume's still kind of up there.
The volume's up there. It's just whether or not you count warm-ups as work.
The muscle moved all of that weight, right? So it's if you bench press 100 pounds, for 10 reps, then 150, then 200 as your pyramid to your one working set. All of those reps count. They're not maybe what you would call your one working set, but the muscle had to do that work. It's all work done, right? So
right.
And if you just don't go to the maximum number, if you're just going to go halfway to that number, so you stop at 200 pounds where the other guy goes to 400, either way, you've moved it X number of pounds, X number of times. And in the end, you've moved whatever it is, 100,000. You could call it a 100,000 pound workout. Both of them might come close to that same number, but one of them only calls the last set the set that mattered, because maybe their perceived exertion was, well, that was the one I felt like I went all out. Whereas the other guy stops short of that higher number,
right?
But he feels like he goes all out on 4 or 5 sets in a row instead of working up to one really, really heavy set.
But then when you take those arguments to like their absurd max, right? It would be someone building a phenomenal bodybuilder level physique off of 50 sets of push-ups, and then another guy building a bodybuilder physique off of one set of a 1 rep max, just pyramiding up to it. And then doing that, the guy doing the girl doing the 1 set for 1 rep max might be doing that once every 15 days. And the push-up person might be doing that every 3rd day. But I feel like on both of those, my bias is like neither one of those would have that effect.
Yeah. I mean, so what is the value of even knowing if this is a thing or not? Like, who cares?
I think it's for people because I think some people want to just get in and out, right? They don't want to be in the gym for.
So the way to figure this out is, as always, it doesn't matter what it happened in anyone else on this channel. We're just about if it's going to work for you. So whatever your goal is, let's just say your goal is to build as much muscle mass as you can. Again, this is a very male-centric kind of topic. Not a lot of women are super concerned about building tons of muscle. But anyways, muscle mass and or strength. Well, the experiment would be specifically for muscle mass. Pick one of these two, doesn't matter which one. If you want to start, logically, you might start at the lowest and work your way up. So the least amount of time in the gym and the least amount of reps in the gym. Reps, because that's like sets reps, just the least amount of weight lifted the least often. And then test to see, I mean, I would say with a DEXA scan, but I suppose you could use circumferences. I don't know how you'll ever prove this when it comes to muscle mass. And over, 6 months, see where you get to. And then I guess from there, do another 6 months in the high volume style and see if the gains in those 6 months were more dramatic than the gains in the previous 6 months. The problem is you're building off of the last gains. So it's super hard to know what's going on here. Also, to Brad's point, if you're naive to this, if you're just starting out, you're going to get naive weight gain, muscle gain regardless. It almost won't matter which one you pick. Like, you're going to have an artificially accelerated gain. And then if you're like me and Brad have been doing this for 30 years, there's no more gains. I'm 50 years old. I'm not gaining anything. I'm just not shrinking at this point. I'm trying to not shrink. So it also matters where you are in your training cycle, like how experienced you are, and how, like, my peak strength was ages ago. My peak muscle mass was ages ago. I'm not ever revisiting that. So you could argue that from a logical lifestyle standpoint, why wouldn't I want to default to the least amount of time spent in the gym just to maintain this? So that could be a thing. So part of my focus is to maintain as much muscle mass as I have, also improve cardiovascular or maintain or improve cardiovascular fitness. But part of that is I do my strength training in almost like half cardio, half strength training style. So I don't mind doing the extra volume because I don't mind the cardio benefit I get during the actual strength training workouts. So I'm getting a muscle mass, let's say, preservation benefit. I'm not really going to gain any more muscle, but I'm kind of killing 2 birds with 1 stone. I do other steady state cardio besides that, but I'm happy to keep my heart rate up during my weight training exercise. I'm not lifting maximum weights anymore. All I'm going to do is get hurt. This is about as much muscle as I'm going to be able to carry from now on. And I don't need any more muscle than this. So my goal, I don't mind doing rep after rep after rep if it's keeping my heart rate up, it's keeping the blood flow going, it's stressing my system both cardiovascularly and some amount of stimulation of protein synthesis. All of that's good for me. So I would rather not go totally minimalist, because I need to get as far as my goal I need to get the hours of movement in. So I would never discount actual exercise movement as something not worth doing.
Yeah, okay. I find that the other issue I see is that not you, but people who are discussing this are only looking at the two variables, right? So if you do a lot of volume to the point where you're sore, that might affect the frequency at which you can train that muscle group.
Mm-hmm.
If you do less volume, so you're not as sore, that might allow a higher frequency. But if the weight was really high and there's possible tendon ligament stress, that could actually be detrimental. So you have those two issues at play as well. And then the one I always think back to is in third year at university. Mike and I were doing a training style where it was 3 weeks of like heavy and minimal, and then 3 weeks of like higher rep and just higher volume. And I remember thinking, I noticed some really good gains for me on the low volume, right? And Mike was like, yeah, but how do you know that's not from the high volume moving to the low volume? And I'm like, oh, Jesus. Now I'm like, but then what happens when you move from low volume to like the change could be what's causing the effect, right? So how do you wash that out? Like if you're doing a trial, right? If you're moving from nothing to high volume versus nothing to low volume, they may have different effects. But if you're moving from high volume to low volume or low volume to high volume, they may have different effects. So there's so much going on that, and anyone watching this, like, yeah, but I've seen there's lots of research from Brad Schoenfield showing that it's like that volume is what matters. But then you can switch right over to like, yeah, but Chris Beardsley shows that it's, after the first 2 or 3 sets, everything else is diminishing returns. So you do have this massive comparatively, of volume of research for strength training, massive for strength training, minimal for every other science, but that's a different story. So you can pick and choose. You can be like, well, I like low volume because it fits my lifestyle and it's supported by this research. Well, someone else is like, well, I like high volume because I like being in the gym for a long time and I'm supported by this research, right? So it is one of those, there's so many factors, and you could even get kind of chicken and egg-ish in terms like, well, I move from low to high or high to low.
Yeah, like what happened with your experiment with Mike.
Yeah, right. And then you question the crap, like which one was it, right? So it's one of those things. It's almost as valuable to argue about that as it is to argue about sports, right?
So in the end here, this is a pointless argument. None of the research is ever going to be conducted long enough to prove one side or the other. To Brad's point, research trials are 16, maybe weeks.
Yeah.
I mean, it takes takes years to build muscle and strength. That type of trial is almost no value because it takes so long to build strength and to build muscle. The strongest Olympic lifters, they peak out somewhere at their early 30s, late 20s, early 30s, but they probably started training.
That 28 to 32 range of
But they started training in their teens. We're talking a decade or more of training to get there.
Yeah.
So somewhere in there, you're going to argue, when has there ever been a 12-year long research trial comparing one to the other? There hasn't, and there never will be. Also,
and then the anecdotes are, we've watched Greg O'Gallagher since he was 17 do very, very low volume and build a very impressive body. But you can just go right next to another influencer, but like that Nemea guy, whatever, he does tons of volume and he's got a great physique too. And we've watched, thanks to social media, like we've watched guys from before they could drive to now they have a wife and kids. And you can just look at the different training styles, and then you can pick that other guy over there, guy or girl. And you're like, yeah, but they were low volume with the high volume with the low, and they still look great now too. So I think it's just effort in the gym. I think it's really,
it's effort in the gym. If it's what fits for your lifestyle, and
at the time,
and which can change over time. It depends on where you are in your training. Your training life. Are you naive in the very beginning? Like if you never trained before, how old are you? You're going to get a boost in gains if you start this in your late teens, mid-teen, late teens. You're going to get that naive boost. Well, you're going to get the naive boost no matter when you start weight training, no matter how old you are. But if you start weight training in your late teens, you're getting kind of a double boost.
Oh, that's the magic,
right? So that would right out of the gates, that will confound whatever you're doing.
Yeah.
Right? You won't know because you're going to gain so quickly. Then are you using drugs or not? If you're using drugs, you're going to gain faster than if you weren't, which also will confound your results. You won't really know. And to my sort of theoretical example between the two ideas, you could easily make the argument anabolics make both styles work.
Yeah.
So either for the enhanced recovery or for the enhanced gains from minimal stimulus. So there's no way out of this. There's no way to prove this. To me, in the end, I think it's just whatever feels good for you and fits your lifestyle in the moment.
And I'm going to throw another wrench into it all, is that we haven't even discussed the fact that it might be muscle group specific, right? So
yes,
you may respond better to a higher volume on biceps than you do on legs. And, it might, whereas some muscle groups you don't really have a connection with, which is something we could talk about later. It just might take a lot to get going. Some muscle groups might take a ton of volume just as the warm up, right? Before you can actually do anything worth the effort. So now where are we, right? We're like, well, I'm high volume upper body, but low volume legs. And then again, to your point, that could switch, or it could be the changing it around. So
it could get the volume specific exercises. Like you're not going to go volume on deadlift no matter what. You're just not going to do it.
But you're not going to go really, really low rep, extremely heavy on like an overhead tricep press. Doesn't make sense. You're trying your elbows.
So you're right. Not only is it muscle group specific, it's even exercise specific. So again, this argument, the more you dig into this argument, the less it makes sense that either there is such thing as a definable junk volume in anything. There's just what works for you. And it doesn't, we already know you can't measure it. You're not going to be doing DEXA scans every couple of months. And you're also not going to do 1 year of one style of training and another year the other style. And to Brad's point, how do you know if
that could just confound everything right there?
How do you know the previous style didn't affect the other style?
Exactly.
So this idea that there's such thing as junk volume, I mean, I guess you could say there is a limit to where you didn't have to go that far, but it doesn't mean you can't. And so what's the other way around this? Okay, unless you're getting measurable deleterious effects, so you're getting injured constantly, it's actually affecting the way you sleep and the way you feel. So not just straight up injuries, like you're actually straining. Now, so repetitive strain injuries, you do an exercise too much and you start straining a tendon, or a joint starts to hurt, or a muscle won't recover. Okay, obviously you've done too much. Now, again, that could just be you're not conditioned for that much, and you could condition your way into it.
Yes.
But for whatever your goal is, I highly doubt your goal is to get injured, right? So that can't be right. So if you're doing too much and you're getting injured, that's a thing. You got to pull back from that. But that also could be that you needed to do some prehab or rehab, and now you can handle the volume. I remember when I first started doing powerlifting with the powerlifting team, the volume jump up from what I was doing was triple what I thought was a normal workout. And I got stronger and I got bigger. So the argument for what I was doing, I wasn't really getting anywhere until I doubled and tripled the volume, and the weight went up too. Just everything went up. So this argument only even makes sense when you're right at the edge of what you can handle, and which most people aren't ever there.
Yeah. And then you have, again, because you brought up some interesting points of a confounder. Again, if you've been in this game for any length of time, you have injuries you're working around. And those injuries sometimes may mean I can't handle a lot of weight, but I can just rep out. Yeah. But sometimes those injuries is like, I can do 3 sets of a really heavy bench, but anything more than 3 sets is not what I'm doing, but tendons start flaring up. But I can handle a lot of weight, right? Not me specifically, but someone might be.
Well, but you could. Right? You could handle more weight on the bench press than I ever could.
Yeah. And that was another interesting point that we should discuss is, like, there is some muscle groups where I can get 2 or 3 sets in. I'm like, that was a good workout. It was done. And then other muscle groups are just like, I've just got to like slog away at multiple, because I don't have that same connection, right? Like my chest can get pumped and sore thinking about benching, but like I just have to do like rep after rep after rep for biceps. I just don't, there's no connection, very rarely a pump, right? So I think it comes down to that as well. That plays in. And then I was thinking about your example of different exercises. And during summer, one of my favorite things is pulling that sled out back, right? You can't do that for low reps. Like you can't just load it up and take like 3 steps. It just doesn't make sense. It has to be a volume-based thing, right? So, and then strength is interesting to me because there's a large part of strength that's a skill.
Oh,
So I wouldn't tell a kid who's trying to learn how to shoot a 3-pointer, like go out and just throw 3 really hard ones and you're done. Right? Like you'd practice the movement over and over. So I think that there is a practice component to weight training that I think people forget about, especially if your goal is strength. There may be a benefit to then not just always lifting heavy, but literally practicing the movement, which would be high volume.
yeah. Yeah.
Right. So there's just so many factors at play. Again, it's just do the work and put the effort in. And then I think it's in tune with your body. Be like, yeah, that's all I need for that muscle group. Or man, that muscle group is not feeling it, or that exercise felt great, but I don't want to do any more of it. Whereas like this exercise, I can just hammer away at. You just gotta figure it out.
Yeah, you got to figure it out for your body. So I guess we've got to try to wrap this up with some takeaway messages here. Okay, first of all, it matters where you are in your training experience. Are you new to this? Are you young? Are you older? If you've been at it for any length of time, the potential result, like you don't have that much left to gain, no matter how you've been training, because a lot of the adaptations already happened. So that's one. Right. Two, what is your actual goal? Is it bigger muscles, or is it more strength, or is it something else entirely? And you'd have to scan, or at least see what the examples are of how people have arrived there. And you'll likely find out you can arrive there with lots of volume or with less volume. There's no actual one answer to this.
Yeah.
Next, so on that one, does it fit your life? Do you even have the time to do the higher volume? You might just be limited by lifestyle. You might be, I got 4 hours a week. That's all I got. And I got to get my weight training and my cardio, whatever fitness stuff. I got to do it all in 4 hours. Well, then this argument doesn't matter. You could get it all done in 4 hours, however you can get it done.
Yeah.
The next is injuries. Can you even handle certain amounts of volume to a certain amount of weight? I could never go as heavy as Brad on bench or anything, because I separated a shoulder. I just can't do it. I have to stay lighter, and I have to just more squeeze the muscle than ever really chase heavier weights.
Right.
Next is muscle group specific. Most people, not all, but most people find that they can handle higher reps on legs, and it seems to work better. Higher reps on legs. Also, we didn't even touch on muscle fiber, what type of muscle fiber mix and types that each person have. Some people just have more type 2 than type 1, so they're just going to respond differently. Different muscle, not only person to person, but muscle group to muscle group. A lot of people can only get their calves to respond to higher reps, not lower reps, but some people, they actually respond to lower reps. So there's how you're genetically built, what exercise will respond, how much time you have. All of those things matter and related to your goal. Injuries matter too. Existing injuries and or if you have a thought to preventing further injuries. And then the learning curve. Have you learned these exercises to their proper form? You've mastered the form. And if you've mastered the form, all that's left to do is just do the reps. Yep. So I don't think there's such thing as junk volume. There's just the amount of volume you can fit into your lifestyle for your goal. And I think as long as you're not getting injured, it's all good.
Yeah.
And there's actually no reason to not move your body. If you just want to go do 30 sets and you can handle the soreness and you kind of enjoy the long workout, it feels good. The pump feels good. Just being in the gym, getting the blood flow going and heating up feels good. Do it. There's no reason to not do it as long as you're not getting injured. There's no proof that extra sets are going to hold you back for some reason. In the end, it's still all just movement, and there's nothing wrong with moving your body as long as you're not getting hurt.
Yeah. And the flip side of that would be for the low volume, I would just ask myself the question, like kind of like the 80-20 rule, right? If I know that doing a couple sets is good, I'm going to get some results, but by only doing a couple, I'm leaving 20% of the growth on the table. And if I'm like, that's fine, then do low volume. If you don't actually care that, if you're like, you know what, getting 80% of my results from 20% of the work out there is fine for me. I'm not going pro. I don't really care. And I'm busy and I've only got a half hour anyways, then absolutely do that. It's still results. It's just not quite as big. That's it.
Yeah. The diminishing returns. Like, do you really need the extra hour in the gym for that tiny little bit extra?
And some people are like, hell yeah. And some people are like, heck no, I'm not. There's no way. So that's a big part of it too. Yeah.
Yeah. And I'd say for most
people, we've cleared this up completely for everyone.
Yeah, we've arrived exactly nowhere. You can do either. And just keep remembering, Mentzer and Schwarzenegger, both as good as it ever got, and they did it the exact opposite way. Yeah. So I would be hard pressed to find anyone who can actually prove one of those is better than the other.
Agreed.
So it's just whatever fits for your lifestyle.
Exactly. If you can prove it, you just ignored a bunch of variables and just looked at one or two, right? You didn't look at the whole picture. So, all righty, that's good.
Yeah, I don't know if that's the answer anybody wanted, but that's the best we can come up with. So
yeah,
I don't know. Let us know in the comments if that makes sense, and if just let us know if that makes sense and what you think we missed. If we need to do a follow up, we will.
Perfect.
All right, so I think that's good for today. So for Brad Pilon, I'm John Barber, and that's your Phi Life Podcast.